together. So let's start with the discussion. Let's start with the first question. Now here they have put a 10-mark question up front, and it is actually a very easy question for 10 marks. So they are asking you role of antibiotics in various classes of surgery in reference to types of the wound classification. Means depending on the type of surgical wound, what is the antibiotic role? So first thing you need to know, what are the classes of surgery based on wound. This is the CDC wound classification, very famous. It has been asked many times. So first, write what each class means, what surgeries are there, what is the infection risk if you don't give antibiotics, and whether antibiotics will have any benefit or no. And in what order are you going to use them? You follow these things day in, day out because you are doing surgeries left, right, center and giving antibiotics. But are you even following many of these practices? Because many times, we are overusing or abusing antibiotics. That's what they want to see. At least do you know the theory behind each? So whether you did a DU perforation surgery or whether you did a lap chole or whether you did an MRM, what should be the post-op or perioperative antibiotic protocol? Right. So first, write the 4 class of surgical wounds, which goes in the order clean, clean contaminated, contaminated, and dirty. Then explain each of these wound categories. In a clean wound, there is no entry into body cavity. So these are superficial surgeries. You can give some examples also, like a hernia repair, inguinal hernia repair, MRM, thyroidectomy, lipoma excision of the subcutaneous area. So these kind of surgeries are going to be clean surgeries. Whether you give antibiotics or not, the risk is low. Okay, risk is less than 1 to 2%. So what is the role of antibiotics here? Normally, no antibiotic is needed. Okay, normally no antibiotic is needed unless you are putting a prosthesis like an implant. So in a hernia mesh surgery, you should give antibiotics, or if the surgery is going to be prolonged for several hours, patient is high risk, like he has a history of infective endocarditis, or he has metallic valves, or he has a valvular heart disease, those kind of patients. And what antibiotic at best you will use in these patients? Single dose cefazolin or any broad spectrum antibiotic prior to incision, 30 to 60 minutes. This is usually going to be given at the time of induction of anesthesia. So when anesthetist will start the induction, first they'll give the antibiotics, do the